All right, and it's now time for your health. Today, we want to discuss cancer and try and demystify facts and fiction, myth and truth. Now, to have that conversation in studio, I'll start with a lady. We are joined by Mercy Kamau, who is a palliative care nurse. Thank you for joining us. We're also joined by Moses Mokaya, who's a nutritionist. And last but not least, Andrew Odhiambo, who's a medical oncologist. Thank you for joining us. A quick reminder that you're welcome to participate in this segment of the show. We are going to have the phone lines open, so should you have a question, and specifically in regards to cancer, you're welcome to call and let us know what your question is. You can also do the same via social media. The hashtag is KTN Morning Express. If you'd like to tweet, it's at KTN Kenya, or you can tweet me directly, and that's at Michael G. Gitonga. I'll start with you, Moses. As a medical oncologist, as an expert who knows a lot to do with cancer, and I know there are not very many in the country, but there is so much information out there, some of it true. I meant Andrew Odhiambo, and some of that information is true. Other information is not true. How do we go about ensuring that we have accurate and precise information when it comes to cancer?
Thank you very much, Mike, for inviting me to the studio. And in order for us to understand a lot about cancer, it's important that we know that cancer is not one disease. There are over 100 different types of cancer, and each of them has a unique sort of behavior and the way that it manifests and it progresses, and even they are treated differently. So to generalize all the cancers together might be very difficult because one may be different from the other. For example, you may get that colon cancer may have an association with diet, for example, in terms of risk factors and so on and so forth. And then if you look at other cancers, for example, that cancers that come in children or brain tumors may have probably nothing to do with diet or whatever you consume. So to lump them all together is what creates the confusion.
And maybe from a layman's perspective, the reason why they are all lumped up together, and maybe you could help us deconstruct that, is because they probably present in a certain way. And for many, whether that be true or not, it's for you to tell us. Many think the minute you hear cancer, it means degeneration of your body, it means that certain organs are going to collapse, and bottom line is that you're going to end up 6 feet under. When you say the different kinds of cancer, help us understand that difference.
Okay, so I'll be very simple in my explanation. When you look at cancers in general, you've got cancers that affect solid organs, like the breast, for example, or the lungs or the liver. And then you've got cancers that affect the blood system, that is your leukemias, for example. So that's how we classify them broadly into two categories. And then within each of the cancers, you have very many different subtypes of cancers that could be in there. I'll give you an example of some types of leukemia which do not even require any treatment. We just tell the patients to come to clinic every 3 months, we check their blood tests, and they live for 20, 30 years with their cancer, and they don't have to die from it. But what creates a lot of confusion and panic is because a lot of the sad stories are the ones that get out on TV, on social media, and those are the ones that create a lot of panic. If at all you are diagnosed with cancer, for example, today or in the course of today, yes, you can panic, but seek information. We are all out there. You can reach out to us, get to see the right set of people, and then get an explanation for what your cancer exactly means. For some people, unfortunately, it will not be a very good story because there are cancers that are very deadly, and patients hardly survive 6 to 9 months from diagnosis. But there are some cancers that people live with or even have to take tablets to stay alive, sort of the same way a diabetic patient would have to take medication for the next 20 or 30 years. It's the same. If we lump them all together, then the ones who have trivial cancers or cancers that are easily curable end up, getting lost in the system and going to other alternative or other treatments that are not helpful, and then they lose the chance for us to cure them.
To cure them.
Yeah.
All right, let me come to you, Mercy, and possibly give us the state of majority of the patients you get, because you're in palliative care. And of course, they come in a certain state of mind, and I'm sure some are stronger than others, even in terms of their mind. And what advice you'd give to those who possibly have been diagnosed with cancer?
What I would advise patients is that a diagnosis of cancer is not, does not mean you'll definitely die. Just like the doctor is saying, we have many cancers that are curable and others are not. So I think the best thing is first understand what cancer you have, get the right information, and do not panic. Don't follow all the information you'll get on social media, all the information you'll get from people who really don't have the right information. If you get the right information, then you will know how to handle your cancer, what treatment do you need, and how do you go about it. I know there's a lot of myth in the palliative care where people think once I'm sent to palliative care, then I'm at end of life. Palliative care is basically support. And actually the word palliative means covering, just making sure that this person is well protected in terms of symptom control, because there are many symptoms that will come with the disease. And they will not access an oncologist all the time. Most of our cancer patients spend most of their time at home. So palliative care is able to reach you at home, and you don't have to keep panicking and running around and running to hospital for small things that can be resolved. Yeah, so I think...
So key word here is that one, they should not panic, and secondly, do a lot of research once you've been diagnosed to know which cancer you have and possibly even the stage.
Yes.
Yeah, okay. Let me come to you, Moses. And of course, nutrition now becomes a huge thing because there's all sorts of myths and maybe facts, you'll tell us, out there in regards to what one should or should not eat when it comes to cancer. Do we know what the cause for cancer is, and as a result, know what to avoid?
That's an interesting question. Let me just say, just like Dr. has said, there are modifiable risk factors to cancer and non-modifiable risk factors to cancer. The modifiable risk factors include, for example, diet, physical activity. I mean, what you do with yourself. The non-modifiable risk factors include, for example, genetics, right? There is some genetic predisposition to some cancers. Diet is one of those factors that you can be able to use in the modification of our lifestyle so that you can reduce the risk. Even if someone has genetic predisposition, good use of diet, physical activity, and general lifestyle can actually delay the onset of cancer. And this is very important, that should go to everyone. Now, let me talk about those things that we know that can be able to reduce the risk to cancer. And let me start with what we all know, body fatness. And when talking about body fatness, let's not kill those people that are obese or people that have a higher weight. Now we know that even if somebody is obese, someone can actually modify their body composition positively, such that the proportion of muscle mass or fat-free mass in the body is higher than fat, even if they are obese. And studies have shown that there's a possibility of reducing this in what we refer to as metabolically healthy obesity.
Okay. I'm going to ask you to hold that thought, because I want us to continue right from there after the break, because that sounds very interesting. Maybe when we come back to answer the question of these predisposing factors are not necessarily the cause for cancer. They only predispose you to that, and maybe just to define that. So for now, we're going to take a short break, but do stay with us as we continue on Your Health to discuss the question of cancer. Do